Hello, I'm Matthew Gavidio. Today in the MGH Life Sciences Medical World News, American Journal of Managed Care is pleased to welcome Dr. Daniel Laroche, a glaucoma specialist in New York. He also serves as Director of Glaucoma Services and President of Advanced Eye Care of New York. Can you just introduce yourself and tell us a little bit about your work?
Yes, my name is Dr. Daniel Laroche. I'm an ophthalmologist. I've been practicing for the last 25 years in New York City. I'm affiliated with New York Eye and Ear Infirmary, at NYU, in private practice with offices in Harlem and Southeast Queens, a clinical assistant professor of ophthalmology at New York Eye and Ear Mount Sinai.
Are there any eye-related implications of COVID-19? In previous research, it was noted that the virus may cause conjunctivitis. Are these concerns still relevant, or have they been added upon in the ophthalmology field?
Yes, with patients that are inpatient at the hospital with COVID-19, about 30% can get conjunctivitis associated with that. Also, there have been reports anecdotally of conjunctivitis being the initial symptom of COVID-19. The majority of cases are spread via the nose, mouth, coughing, touching with the hands. It's very important to hand wash, very important to wear a mask. At the hospital, as a surgeon, when we're at the hospital, we are asked to wear eye protection. And I think it's not unreasonable for those at higher risk, people over the age of 70, people with immunocompromised states that have to go out, for them to wear eye protection as well to really reduce the risk of spread.
Can you discuss the importance of eye health amid the COVID-19 pandemic? I know you just alluded to the older population, but how can better management of eye-related issues assist Americans during this time?
Yeah, well, the leading causes of blindness are like cataracts, glaucoma, diabetic retinopathy, macular degeneration. And during this period of time, people still need access to eye care. They still need to be able to see their doctors. I mean, I'll give you an example of a tragic situation that happened recently. I had a patient who was 91 years old. I did cataract and glaucoma surgery in one eye, and she was doing great. And she was scheduled to have the other eye done before the lockdown. Her pressures were high, so it was a little bit urgent for her to have the surgery done. But she was scared to have the surgery because of COVID. And we shut down in New York, and all elective surgery was canceled. And then at some point, urgent surgeries reopened again. And I wanted to bring her to the operating room, but she still was scared to come out because of COVID. And I recently saw her just last week. And by the time I saw her, which is like a few months later now, she was completely blind in that eye. And in New York City as well, we've had several people die at home from lack of access to care, for heart disease, for a variety of different things. And people have lost vision from glaucoma and other diseases because they just did not come out because they were scared to come out. So the key thing is we do telehealth. It's very important for seniors to connect with their doctors via telehealth. Now, another problem that we had is a lot of seniors don't have a smartphone or don't know how to use a smartphone. So we've educated families to work, the younger kids and the younger generation to work with educating the seniors how to use a smartphone, how to communicate with your doctor, to see if you do need to have something urgent done to come in, or if not, it's okay. You can delay care for 3 to 4 months and then communicate that way. And that's what we've done as well in our office. So we do telehealth visits for the high-risk population. And if they do need to come in because they have an unstable situation, we're able to give them instructions to wear a mask, come on in. We have plexiglass, we have hand sanitizer here, we do social distancing in the office, and have them come in spaced apart so they can feel safe and get the care that they need.
One significant issue that has resurfaced amid the pandemic are notable inequalities in COVID-19 related outcomes for minority populations. What are some steps that ophthalmologists are taking to ensure that eye health is maintained among these at-risk groups?
Well, that's a big question. The health disparities that we're seeing in COVID-19 have really been here for hundreds of years in the United States. It's just that COVID-19 has really put a light on it because the death rate amongst Blacks and Afro Latinos are anywhere from 2 to 4 times higher. And the reasons for that is due to many reasons. One, lack of access to care, lack of health insurance, the fact that Black and Afro Latinos make a higher percentage of essential service workers in supermarkets, transportation, deliveries, and so they're exposed to the virus. And also, there's a lack of minority healthcare providers as well. I'll give you an example. There are about 41 million Blacks in the United States, but as an eye surgeon, there's only 400 Black ophthalmologists. So there's a huge lack of access to care. The other 26,000 ophthalmologists are dispersed. There's a huge maldistribution problem. Many of them on the East Coast, on the West Coast, not as much in the South. Unfortunately, we have a lot of residential segregation. And so many of them don't practice in Black communities. So a lot of Blacks don't have access to specialist care. And so we really need to relook at the whole system and revamp the whole system to address these issues on multiple fronts. And that includes providing universal health care for everyone so people have access, equal universal health care, not tiered where someone has Medicare and someone has Medicaid, because patients who have Medicaid usually have to go to a clinic. The next appointment may be in the next 4 to 6 months. They're seeing student doctors and not getting the type of care that they can get when you have a Medicare type of insurance. Increasing the number of Black and Afro Latino physicians as specialists as well, and ramping that up from a very young level. And doctors right now are maintaining their offices open, doing telehealth, trying to see patients to get people in to get the care that they need, and doing something like this, educating people, educating practitioners, educating patients about the importance of getting an eye exam, getting checked for cataracts, glaucoma, diabetic retinopathy, those types of things. The other thing one could do is personal responsibility. We do have a high incidence of obesity in the community and in America as a whole. And people that are obese, there's a higher death rate with COVID. So we are very early in the pandemic. So something that people can do at home, and we go over my patients, is weight loss, diet, exercise, and specific recommendations. I mean, vegetable juice, where within a blender, you can put like cucumber, spinach, celery, blueberries, blend that into a drink. Drink that 2 or 3 times a day. That suppresses your appetite, gives you the excellent nutrients you need, vitamin A, vitamin C, vitamin E. The other thing is you can take a zinc supplement also to help strengthen your immune system, a vitamin D supplement to fight off COVID when it comes your way. So the leaner you are and the more nutritious you are in terms of building up your immune system, that's going to help you fight off the virus when it comes.
And additionally, can you speak on eye-related care among the general population? Are there distinct populations who are more at risk for eye issues?
Yes, the elderly in particular. You want to make sure you get an eye exam once a year. Macular degeneration, cataracts, diabetic retinopathy, glaucoma, all big ones. People over the age of 40, you want to get your eyes checked to see if you need glasses, particularly for reading. We're all on computers right now with Zoom, so you want to make sure you have the correct prescription. And you want to follow the 20-20-20 rule, which is every 20 minutes, look away from the computer for 20 seconds far off to help reduce strain on the eye, okay? And so that's one of the things that you want to do to help. And then for the young kids, you want to do the same thing, because young children, when they're looking at the screen all day, you can get increased myopia. So it's very important for them to do outdoors activities. Spend 30 minutes to an hour doing outdoors activities, and every 20 minutes, look at something more than 20 feet away for greater than 20 seconds. Okay, and take a break, walk around, hydrate yourself, eat healthy foods.
What further steps are warranted to promote eye health and combat inequalities in healthcare among minority populations?
Well, I touched on some of that already. I think we have to provide universal health care for everyone. We have to eliminate structural racism in housing, in employment, and mass incarceration, in health. There are huge financial wealth disparities. The average white family, the net worth is about $170,000. Net worth of a Black family is $17,000. That huge gap has to be bridged, because with increased wealth, you get increased health. The average income of Asians, for example, make the most, is highest, about $80,000 a year. Whites is about $70,000. Hispanics is about $50,000, and Blacks at $40,000. So we have to try to bridge that gap. Unfortunately, part of that is there is some structural racism that underlies that. I'll give you an example. In New York City, Bronx Heights Bronx Science is a magnet high school, okay? That magnet high school produces the future doctors, the future lawyers, the future business people. In that high school right now, it's about 65% Asian and only 3% Black, despite the fact that in New York, the Black population is 26% and the Asian population is 13%. The sole reason for that is a standardized test scored entry exam, okay? That's a structural barrier that's creating these disparities. If these type of schools change the policy to say, hey, look, we're going to take the best students from each community, the best students from the Bronx, the best students from Queens, Brooklyn, Manhattan. If you just take the best from each high school, that would immediately diversify it to represent the population. So those are the type of structural barriers we have to break down and change to ensure adequate equity across the board and stop some of this systemic discrimination that's taking place. So those are some of the major things. And also all government funding of corporations, health institutions should be tied to diversity. For example, a vaccine company recently got $1.5 billion from the government, okay? Part of that money should be tied to employing a diverse workforce and training of a diverse workforce, right there. That will help solve the problem. We're not thinking like that, but we have to think outside the box because that type of investment is going to make our society better and help reduce these disparities. I mean, we're in a tough time right now in the era of COVID. We have a lot of poverty. People are suffering. People have lack of access to food, lack of access to jobs, lack of access to income. Martin Luther King talked about providing a universal income where people could get a stipend of maybe $400 a week if they're certain below the poverty line. I think we have to think like that. These temporary stimulus incomes are good for the short term, but I think we need to have a more permanent solution like that to reduce poverty. That's a big issue that we're having, that leads to all these inequities. And John F. Kennedy, Robert Kennedy, Martin Luther King, they were working on that, but they all got assassinated. And we're right back here where we are now. So we have to revisit those types of things to help bring forth equality.
And for people seeking eye care, how can they get in touch with you?
They can visit my website at www.advancedeyecareny.com or glaucomamd.com. Dr. Daniel Laroche, you can Google and my information should come up.
To learn more, visit our website, ajmc.com. I'm Matthew Gavidia. Thanks for joining us.